avoid telling people about my mental illness.
It affects all walks of life, all jobs, all socioeconomic status.
I've been discriminated against by employers because of my substance use disorder.
We as a society tend to look at people with mental illness and people with substance abuse disorders like it's a character flaw. It's not a character flaw.
I'm embarrassed by the reaction people have when they find out I have a mental illness.
Fearful of being judged, being afraid that others, especially those who are closest to you, will judge you.
I'm afraid of how other people will react if they find out about my substance use disorder.
People are very biased, very, very biased. You don't treat a cancer patient or a diabetic the way you treat mental health patients.
Day after day, I feel worthless, alone, and lost.
There are lots of people out there suffering. People just like you and me. People with families, with great jobs.
I tried to hide the symptoms of my depression from my doctor.
We all know people who suffer in silence. They shouldn't have to feel that they cannot talk with their healthcare provider about their mental pain.
I feel I would have been given better chances in life if I didn't have a substance use disorder.
I just want to be treated the way everybody else is treated. People with diabetes don't get judged. People with cancer don't get judged. So me having a mental illness, why am I judged?
I feel like doctors treat me differently.
I was going through a lot of emotions and I needed my doctor to be, okay, I know this is what happened, not automatically judge me.
I don't always understand what the doctor tells me.
If I have a mental illness and I'm symptomatic, I may manifest that as yelling.
I feel like I'm a burden on everyone just by being alive.
A lot of people are reluctant to accept help because they feel like it's punitive, like it's a punishment.
I feel like they hear me, but they don't understand.
I think you need to keep an open mind to people's complaints. Those symptoms are real and they need to be addressed.
I feel like I'm being talked down to.
Respect people so that they feel they can tell and you're open to them telling you about their mental and physical pain.
I can't stop feeling that my mental illness is somehow my fault.
I've seen in my experience, I've seen it cross all gender and race and lines of faith.
I can't tell anyone about my psychological treatment.
I want to be there for people like I wish someone would have been there for me. It's really, really hard with mental health. It's hard because a lot of people don't want to deal with it.
I don't tell anyone that I take medication for my depression.
If medications are needed, we're able to provide those. So it's more of a medical model. When I screen everyone.
I'm tired of how people treat me when they find out about my substance use disorder.
Until it's your college-educated child or your kid from two-parent home, until that happens, I think that unfortunately that stigma will remain.
I don't tell my doctor everything because I'm afraid of what will happen.
All I needed was one person not to give up on me. Stay in contact. If they don't show up for the appointment, call and say you missed an appointment. Are you okay? Follow through.
I avoid getting care because of my substance use disorder.
We need to have people be comfortable enough in first educating them as to what the resources are in our communities, and then giving them enough comfort that they on their own will pursue the resources at their disposal.
I'm tired of being dismissed and not taken seriously.
They may indeed have a true physical problem, so you can never take anything for granted or dismiss somebody's complaints. One thing we're doing here now in this practice and in some of the other practices in the North Country is trying to integrate mental health care into the practice, and I think that may really help.
What can we do to help this child or help this family cope with what's happening? Helping people to manage their health regardless of whether it's physical or mental. If we can't share the burden of taking care of behavioral health issues in a primary care physician's office, there are many, many people who will get no care. And do we really want to say that? I don't think we do.